The next, I'd like to cover a very common and nuisance problem with which every age group goes through in a humid city of Bombay, which is ringworm infection or fungal infection, और जो हमारी भाषा में दाद बोलते हैं, धादर बोलते हैं, या टीनिया बोलते हैं in medical terms. So again, some tips to avoid your fungal infections or ringworms in summers. So one is, we need to understand कि I have a lot of people coming and saying कि मुझे धाद हो गया है क्योंकि ये साफ नहीं रखता है, ये नहाता नहीं बराबर. Ringworm or fungal infection is not because of unhygiene. I know people जो दिन में 10 बार नहाते हैं, लेकिन उनको भी fungal infection हो सकता है because आप उसको वहाँ पे पोंछ के सूखा नहीं करते हैं. And I have people who don't have time to bathe regularly, but they change their clothes, they change their inners frequently so that our skin area is dry, because fungal infection is because of collection of moisture. In nature's law is जहाँ पे भी moisture collect होगा, वहाँ पे fungus attract होता है. And skin में body folds, especially your groin folds, underarm folds, waistline, below the breast area, buttock area, इन जगह पे ज़्यादा sweat collect होता है. And because of this sweat collection in these areas, we are more prone to collect and get fungal infection. So again, as discussed, ringworm is not because of unhygiene, but it is due to moisture. So instead of frequent washing, we need to wipe the body folds dry. So keep a napkin or a towel in your washroom, or people who are traveling and commuting, use tissue papers to wipe the body folds dry after you wash that area so that it is dry, and that will prevent further fungal infection. Second is, people tend to use a lot of antibacterial or antifungal soaps. People tend to use a lot of body washes. Again, as we discussed, using overuse of soaps and body washes can make your skin go dry. अगर आपका skin dry हो जाएगा तो आपका ऊपर का layer जो है skin का वो break हो जाता है barrier. So आपका fungus को ज़्यादा easy entry मिलता है skin के अंदर, and that causes faster entry of fungus and more symptoms of fungus and gives you more itching. So again, as discussed, mild soaps and quick showers will help to keep the skin less dry and itchy. Next is very important in today's generation. We tend to use a lot of fashionable clothes like denims and lycra materials, and these are not absorbing sweat. We need to understand all these heavy materials will give you more sweat and moisture. I have people coming and saying, Doctor, मुझे पसीना नहीं आता. We need to understand कि अगर हमें पसीना नहीं आ रहा है तो हम जिंदा नहीं है. आपको भले वो टपकने वाला पसीना नहीं आ रहा होगा, लेकिन आप बॉडी फोल्ड्स में वेट होते हैं. एंड जितना आप डेनिम्स पहनते हैं, जितना आप ये जर्सी मटेरियल्स जो ये क्रिकेटर्स और ये सब पहनते हैं, we are using it regularly at home these days. We are using it as our home clothes. We are using it as our college wear. We are wearing jerseys to college. And ये jerseys ज़्यादा sweat absorb नहीं कर पाते, अपना body को ये wet रखते हैं, and that will give you more fungal infection. So we recommend loose clothings, cotton clothings, and more importantly, we need to keep wiping that area dry and change your inners frequently. And another tip for youngsters is they will tend to overuse their jeans. हम एक ही jeans 2-3 दिन पहनते हैं फिर धोने डालते हैं. Guys have a lot of tendency to do that. So we strongly recommend कि रोज के कपड़े रोज धोने डालने चाहिए, and should wear loose and cotton clothes whenever possible. At least when you're at home. आप बाहर रहो, आप fashion करो, कोई problem नहीं है. But जैसे ही घर आते हो, first thing you change into a comfortable inner and into comfortable clothing, and then you do your routine. This is what we recommend to prevent fungal infection from keep happening on a regular basis. Lastly, antifungal powders. This is a little controversial these days because एक ज़माने में antifungal powders बहुत recommend होते थे for keeping your body folds dry and for preventing fungal infection. But now studies tell us कि antifungal powders आप लगाते हैं और वो लगाने के बाद थोड़ा सा भी जब sweat आता है तो it becomes like a paste over there, and that paste causes again irritation in the body folds. Also, there is a new theory which says that by using antifungal powders, we are giving you medicine in a mild dose, what we call as microdosing. And this over a period of time is causing what we call as a drug resistance. So we are actually creating problems by using antifungal powders, because फिर वो ही दवाई के रूप में जब आपको देंगे तो वो दवाई काम नहीं करेगी. So this is what we call as micro drug resistance. That is why nowadays we strongly don't recommend to use antifungal powders unless you are using it in your shoes or in your socks to prevent that sogginess. Neither on a routine basis, we tell you to use no powders, and we tell you to instead wipe your body dry, that is more effective in preventing fungal infection. Lastly, fungal infection, as we discussed, is more on the body folds. So जहाँ पे भी sweat collect होता है, अगर वहाँ पे hair ज़्यादा रहेगा, so we tend to sweat gets collected for longer. So we recommend you to keep your body hair short, especially the body folds. So your groin, pubic hair, your underarm hair, keep it short with either a trimmer or a scissor. Using too much of waxing, too much of razors and epilators on already a damaged skin can cause more damage. So strongly recommending to use trimmers and scissors so that the skin is not damaged and the hair is short, so that there is less collection of sweat and moisture in that area. And a lot of concept is as we discussed, the inners should be a little loose and a little more airy. So we have a trend of wearing a lot of those tight fitting boxers, even females, even in males, and having those tight inners which we're wearing for entire days, which is not recommended. So we prefer boxer shorts so that there is less the elastic creases in the body folds. And also we tell them to wash their inners separately. For people who can afford it and people who have a constant fungal infection in the family, we recommend to wash their inners in a hot water cycle of their washing machines at 60 degrees Celsius for 20 minutes. But not everybody can do that. So at least we recommend कि at least आपके inners आप अलग धोइए, गर्म पानी में धो के सुखाइए, and never wear wet clothes. That's why we recommend to change your clothes twice a day and wear loose and cotton inners. Boxer shorts recommended as an inner wear for both males and females. So lastly, just summing up whatever we have talked about the fungal infection, is it's a purely skin disease. Again, not related to food. खाना खाने से नहीं होता है, साथ में खाने से नहीं होता है, खून में कोई खराबी होने से नहीं होता है. बट यस, अगर आपको डायबिटीज है, ब्लड प्रेशर डायबिटीज है और वो कंट्रोल में नहीं है, तो आपका फंगल इन्फेक्शन बढ़ सकता है. सेकेंडली, इट इज रिलेटेड टू मॉइस्चर एंड स्वेटिंग एज डिस्कस्ड. Not related to unhygiene, very important, and it can be contagious by close contact. So if you are scratching one area and आप वही हाथ कहीं और लगाते हो, that is how you spread it. So इसलिए we should avoid scratching and treat it rightly. Lastly, as discussed, the denims and lycra materials and the synthetic clothing for long hours can be a problem. Tight fitting inners can be a problem. Staying in water for too long can be a problem. Using too much of oil massages and powders can be a problem. And I see a lot of doctors or quacks giving a lot of injections for quick fixes in these areas for the fungal infection. Again, sometimes they can go wrong because many a times these injections, we honestly don't know what they contain, but by the effects of it, they look like containing steroids, which can itself give you problems. So the take-home messages for fungal infection should be: do not self-medicate. I'll tell you why. Second is avoid remedies suggested by relatives and chemists, because invariably we go to, हमें खुजली आती है, हम डॉक्टर के पास नहीं जाएंगे, हम केमिस्ट के पास जाके बोलेंगे भैया खुजली आ रही है, खुजली की क्रीम दे दो, and we do not know what they contain. And check the ingredients before you use it. Nowadays, thanks to the technology, we all have Google on our smartphones, we all have internet on our phones. All you have to do is जो भी आप ट्यूब यूज कर रहे हो, प्लीज उसको गूगल करके चेक कीजिए कि आप क्या यूज कर रहे हो, एंड आप उसके कंटेंट्स आप समझ जाओगे कि आप उसमें स्टेरॉइड इंग्रेडिएंट्स है कि नहीं है, और उसमें आपको दिक्कत देगा. The most commonly used tubes and given by these chemists and by quacks and non-professional doctors are all these tubes mentioned here. I have no personal gain, but this is 90% of the wrong tubes which most of us have at home, and जिसके वजह से हमें problems आती है. So please have a look at these names, and इसमें से कोई भी अगर आप घर पे आपके है तो इसको आज ही कचरे के डब्बे में फेंक दीजिए. I tell my patients the same thing. मैं नींद में भी मेरे दुश्मन को भी ये ट्यूब ना दूं. It is that wrong a tube to use, because all these tubes contain steroid, and it is like an addiction. So जब भी आप ये ट्यूब लगाओगे तभी के लिए आपका इचिंग कम हो जाएगा, आपके रैशेस आपको लगेंगे कि खत्म हो गया है, आपको बहुत अच्छा लगेगा. लेकिन जैसे ही आपका ट्यूब आप बंद करोगे, ये रैशेस, इचिंग सिम्टम्स डबल हो जाएंगे, एंड फिर आपको वापस से वो ट्यूब लगानी पड़ेगी. सो दिस इज व्हाट वी कॉल एज एन एडिक्शन. जस्ट लाइक इफ आई स्मोक, आई फील नाइस, बट शुड आई स्मोक? No, because the smoking is going to cause permanent damage to my lungs. Similarly, आप ये ट्यूब बार बार लगा के स्किन को परमानेंटली सेंसिटिव और डैमेज कर देते हैं, स्किन को परमानेंटली पतला कर देते हैं. You will see a lot of people having a lot of stretch marks and those lines in their groin folds and all. These are all because of wrong choice of tubes. And then जब आप वो ट्यूब बंद करने जाते हैं, सेम वे जब मैं एडिक्शन छोड़ता हूँ तो मुझे खांसी आएगी, मुझे तकलीफ होगा, लेकिन अगर मुझे लॉन्ग टर्म के लिए ठीक होना है तो मुझे वो एडिक्शन छोड़ना है। सिमिलरली ये जो ट्यूब्स अगर आप लगा भी रहे हैं तो आज ही उसको बंद कीजिए। हो सकता है पहले 4-5 दिन तकलीफ बढ़ेगी, बट एटलीस्ट गलत वापस ट्यूब नहीं लगाएंगे तो एटलीस्ट आगे जाके आपको प्रॉब्लम सॉल्व हो जाए। Because irreversible damages are possible, and I have so many patients who come after damaging the skin and then they say, doctor abhi isko theek karo. So doctors cannot change the damage which has already been done. So consult your doctor, do not self medicate and do not use these wrong tubes on your skin because that can definitely give you damages. So agar aapke koi relatives ye use kar bhi rahe hai to please suggest them not to go for these tubes for any part of the body, not just for the groins.